I've been a nurse for about 7 years.
Hi, my name is Thomas Falcom, and I've been a nurse for about 3.5 years.
My name's Ken Marr. I've been a nurse for 10 years.
I have many times I've had women, especially older women, who will say, "Can I get a female nurse or the CNA? Could they help me instead?" So that happens quite a bit, actually.
I would say it has, on occasion, there will be like a woman who's a patient who is not comfortable with me getting her up to the bathroom or putting in a Foley catheter, but I'd say, 99 times out of 100, it doesn't make a difference.
Sure, there's some times that patients don't want a male nurse to be providing care.
Well, there's a lot of usually little old ladies, and they just don't. One specific note I can think of, I had a lady that she had to go to the bathroom this very second, and I was there, and I was like, "Well, you have a choice. You can hold it, or you can let me get you up, because I'm the available person. I can't tell you exactly when the next person is going to be here." And I ended up getting her up that time.
I mean, certain women don't want a guy to even walk them to the bathroom, and then other women are fine with providing whatever care you need to provide that is much more, shall we say, of a private nature. And it really just depends on the patient. It depends on their culture and kind of what their thoughts are around these kind of things. It maybe depends on their, theoretically, if someone's had a bad experience in the past, then they could be less willing to put themselves out to let a man help them if they've been mistreated in the past.
Usually, I feel more sorry for the patients, because they're the ones who are going to have to wait. I usually have 3 to 4 patients. CNAs have up to 10 patients or more. So if they just by that ratio, I'm going to have a better chance of being able to get them up the most. So if they have to wait, they're just going to have to wait, and I feel bad for them for that. But it doesn't bother me. I'd rather not help them up if they don't want me to.
I just brush it off my shoulder, and I realize people have their own preferences, and as a nurse, I have to respect that. So I don't take it personally.
It doesn't bother me. I feel like that I would much rather someone speak up and say that they're uncomfortable with this, rather than me providing care and them being uncomfortable with me providing the care.
No, it's fine. I think that's people's own things. I try to explain that I'm a professional, and that it doesn't bother me to do these things. I think the most challenging part is just the fact that the patient is making a choice that's going to make it harder on them. That they're going to have to wait, or they're going to have to let me do it. I feel sad for them that they have to wait, but I mean, that's just sort of how it is.
Probably the most challenging is just being tactful in applying or providing good care, while also being sensitive to the patient's needs and preferences.
Well, the only thing that's challenging is that I have to ask other people to do work for my patients. I'm uncomfortable with the other people having to pick up the slack because I can't provide the care.
I don't think so. No, I don't know. I guess it would be cooler to work with a bunch of guys, and we could talk about hunting or whatever. But no, I don't think that it really affects my job satisfaction.
No, try to treat all patients, with respect, regardless of where they live or who they are. And so if I come to a situation like that that's challenging or a roadblock, I try to just get around it while providing good care. And
No, I don't feel like it does. I feel like with a lot of the patients that don't want me to do particular things, they'll still let me do assessments and do a lot of other parts of my job and they're very appreciative of care, even though they just don't want me to walk them to the bathroom or whatever.
I have a memory of in nursing school, and we were doing, it was one of the very first clinicals where we were in like a classroom, and there was plastic mannequins, and we were learning to turn patients and all these things. And there was a Foley mannequin of a female, and very plasticky, and we were practicing putting the Foley in on this female mannequin. And it was like the first time in my nursing career or my student career that I realized that eventually someday it will be my job to like have to insert Foleys into old lady vaginas. And that seemed, at that moment, was a very overwhelming experience for me. I was a little freaked out. And actually my professor lied to me a little bit. She said, "Oh, don't worry about that. When you're a nurse, we usually let females do females and males do males," which I have never seen that other than this one male nurse that won't do female catheters. Since then, but it made me feel really good at the time until I was probably more comfortable. So I guess lie to your students. I think that's probably what I would suggest. No, I'm just kidding. But realize that eventually in the beginning that we're going to have lots of anxieties, and that as they progress in nursing, they'll lose a lot of those anxieties.
I would say nursing is an awesome field that is very rewarding, has good benefits. In terms of advice, I would say don't write nursing off because your mom or sister were a nurse. That's what I did. But once I actually looked into it, it was a really good fit for me. It has its challenges, but there are so many different areas of nursing that you can be involved in. I would just say stick with it, and the most important thing is doing job shadows and finding out is this a good fit for me, and then just not giving up once you make it through school and find a job. And it is just a really, really good career and profession to be in.
Don't take it personally. It's not about you. It's about the patient. Be professional. Don't try to skirt your responsibility by just immediately saying, "Would you like a woman to do this?" But you can say, "Are you comfortable with me doing?" and then state what the nature of the care is, and they'll tell you if they don't want you to do that. When you're dealing with female patients, tell them what you're going to do, and if they have a problem with that, they'll speak up.
It's hard. I mean, it's hard, different to be a minority. I think though that men bring different strengths usually, or just depending. So I think I would say that part of learning to nurse is learning to know what your strengths are and finding other people's strengths, and encouraging people to delegate to people who have stronger in certain places. So.
I think it would just be like maybe one lecture, not a lot. Mm-hmm. It could be addressed, but you certainly don't need to spend a whole class on it. I think that all in all, women are becoming more and more comfortable with the fact that there are male caregivers. Mm-hmm. So that over the course of time, but it's still going to depend on culture, and it's also still going to depend on the patient's prior experience, whether they're going to have a sensitivity to being uncomfortable with you doing certain care. As being a male nurse. So I saw Meet the Parents a couple of weeks ago, and I was reminded that for some people there's this huge stigma around being a male nurse, which I just find amusing because I don't even. It doesn't really occur to me most of the time. I'm not a male nurse. I'm just a nurse. I think most doctors who happen to be women don't think of them as female doctors. They're just doctors. Mm-hmm. But that just kind of shows that in 30 years there's been a huge shift, because if you looked at the number of men in nursing 30 years ago, I think you would find it amazingly small. Mm-hmm. And now it's just kind of normal. Most people don't, bat an eyelash when, my name's Ken, I'm going to be your nurse today. Is okay. It's like, it's normal. It's